over to Dennis.
Hey, thanks, Laura. This is Dennis Burrell at the Coalition of Texans with Disabilities. And my audio description, I'm a pretty gray guy. I'm an Anglo male with gray hair, gray beard, nicely trimmed, I think, wearing kind of a bluish gray shirt. Thank you all for joining us today. So this is put on by the Coalition of Texans with Disabilities. A lot of people call us by our initials, CTD. So when you hear that is us. Well, who are we? We're a cross-disability advocacy organization, which means we deal with issues surrounding people with disabilities of all disabilities, all ages. And as an advocacy organization, we've been doing this for 42 years. So that makes us one of the oldest and definitely the largest cross-disability advocacy organization in Texas. One thing about CTD and our history in advocacy, we always involve self-advocates. People like many of you on this call today, or family members of those on the call today. And we value community input. We don't chase issues on what we come up with in our staff meetings. We chase the issues from what you tell us. So what to expect out of Raise Your Voice? Well, today is a launch, so we're going to cover, several different priority issues and give you an opportunity to speak. But in coming Raise Your Voice meetings, which will be virtual meetings, we have a number set up on Wednesday afternoons coming up. You'll receive that information later. And there will be more deep dives into specific areas. But what can you expect? Number one, we will value you. We will listen to you. We will involve you. We will share information with you, maybe processes on advocacy, how a bill becomes law, dealing with the state agency, maybe the background or depth information on a certain issue. You will work with other self-advocates and share your ideas and experiences. You will have collaborators here at CTD, our advocacy team. We have experienced people who work in advocacy. We are here to collaborate with you. We don't lead you, we collaborate with you, we work together. And finally, where are we going with all this? The 2021, that's in January, just 5 months from now, Texas legislative session, we're gonna pursue good bills, appropriations for good programs, and work to make the world a better place for citizens with disabilities. Now we're gonna spend a few minutes here talking about some of CTD's priority issues. I'm going to talk a few, and then some of my colleagues will talk on a few. Do not think these are the only issues we will address. We will address maybe 40 or more issues in the session. Some of those issues may come out of ideas from y'all on today or in the next few weeks. So I will address a couple of our priority issues. This first one is one many of you are familiar with. It has to do with community attendance, recruitment, and retention. And yes, this is pretty much a monetary thing. We need to pay our attendants more. Hey, Laura, would you go ahead and share that first graphic while I talk? Community attendants are primarily in Medicaid programs. There are some that are on Medicaid. The base wage for most of these attendants is $8.11 per hour with no benefits. Since 2013, these attendants have received cumulative raises of, get this, 25 cents per hour. So as you can guess, that is not an adequate wage. This is for work where people are doing very personal work, coming to the homes of older adults and people with disabilities and helping them with activities of daily living. Some simple, maybe light housekeeping, laundry. Some actually getting people dressed, using the bathroom, showering, very personal stuff. So what you're going to see here is an interesting chart. It's called Community Attendant Wages. And this is 2016, so it's a little bit dated, but you will get the idea. This covers the real wage of community attendants since pretty well the start of Medicaid community care in Texas, and it is adjusted for inflation. And what you can see is looking left to right is a steady downward trend. That means our community attendants have been getting paid less and less and less. And the difference is, over time, an erosion of about 30% of their wage. That's right. Since the early days of community attendant programs in Texas, the average wage has gone down by 30% for this critical direct care workforce. Now, these wages are set by the Texas legislature. Now, Laura, would you put up the next graphic, please? The rest of the world sets wages in a very different way. It's called the market wages. Here is an example. Buc-ee's is a gas station and convenience store. These, note their title here, they're advertising for people to come to work with them. Their wages are $14, $15, $16 an hour. And if you look at the bottom, you also get, things like healthcare. You also get lunch, by the way, 401k, paid time off. That is the difference between market wages and legislatively set wages. Now you can drop that back down. Thank you, Laura. And why is this issue so important? Because for people to stay healthy, independent, and safe in their own homes, to stay out of emergency rooms, out of hospitals, out of unnecessary institutionalization in nursing homes, they need reliable community attendance. It is smart public policy to pay small dollars to give a fair wage to community attendants and save big dollars on more complicated healthcare. Where's our goal in 2021? Our goal is to raise the base wage to $15 per hour. Not too much to ask, a big jump in money, but not too much. And a mechanism so that this wage increases sort of along with inflation, so it just doesn't erode. That is priority issue one. Priority issue two, I'll be a little quicker. This is about dental benefits, dental services, and Medicaid. There's a lot of dental benefits in Medicaid if you're a kid, which is more than 3/4 of people in Medicaid in Texas. If you're an adult in an institution, you get a dental benefit. If you're in a community Medicaid waiver, you get a dental benefit. But if you live in the community on Medicaid and you're not in the waivers, which is about 90% of the adults in the community, adults with disabilities, you get only emergency care. So I'm going to give the air quotes thing, emergency. That implies if you got a crisis situation, you get some dental benefits. That's not true. That means if you're in agonizing dental pain, you get to go to the emergency room where you get a painkiller, quite often opioids, and an antibiotic to deal with the infection and nothing to deal with the underlying cause of your pain. So Laura, if you'll put up the next graphic, please. Good news about this issue is we've made some progress. In 2017, we got a bill passed in the legislature to study a preventive dental benefit for adults. In 2019, we took it another step further, and the legislature approved a pilot to be on for adults with disabilities in Medicaid for preventive dental benefits. So by the way, that was the first time in Texas statute that such dental benefits for all adults in Medicaid is even mentioned. So that was a big move. Now we know a couple of managed care organizations are doing their own pilots, and we know HHSC is doing a further study. If you could pop up that graphic of the hearing, Laura, I'd appreciate it.
Dennis, I'm sorry, the screen share messes up some folks with disabilities, so I think you should just continue to describe that photo so that we can all know what's
okay. Okay, thank you. So, by the way, I should have mentioned that this is an experimental program, and this is our first time out, so bear with us if we have a few glitches. At the hearing, what you would see is a number of people standing in front of the basically the hearing room. And what you would see there is you would see self-advocates. I would be there. There'd be some of our research colleagues. There'll be a dentist, and there'll be leaders of the faith community who are our partners in this, among many other organizations that are our partners in this. So we've been able to move this. Now, why is it important to have, for adults to have a preventive dental benefit? Well, it keeps them out of those emergency rooms with agonizing dental pain. And what's worse, it could keep them out of hospitals. Believe it or not, an untreated cavity over time put somebody in a hospital. And that's a really bad situation. That's when they're having their faces drained. Yes, that's right. Their face is drained. And believe it or not, they die. Every year, there are Medicaid adults that die due to untreated cavities. Oh, and the other thing about this is their overall health is better with dental. We know that poor oral health leads to heart disease, diabetes, higher rate of cancer, hypertension, stroke, a lot of bad things. So let's keep people healthy. Let's allow them to chew their nutritious food. Let's reduce acute care costs for chronic conditions. This again is smart public policy. What is our goal in 2021? We want to get a preventive dental benefit for all adults with disabilities in Medicaid. We think it's smart. We think we can get there. For the next set of priority issues, I'm going to kick this to Chase Bearden. Take it away, Chase.
Thanks, Dennis. Good afternoon. My name is Chase Bearden. I'm the Deputy Director at the Coalition of Texans with Disabilities, and I'm going to audio describe myself. I'm a white male with blonde hair, wearing a blue shirt, and I use a wheelchair. I've worked with CTD for over 11 or 12 years now, and in my years, two of the bigger issues I've gotten to work on and really enjoy, the first one being voting, is going to be a priority issue of ours in the upcoming legislative session. I think for most people living in the disability community, voting is one of those issues that crosses all of the lines that we all need to participate. We all need to find a way to make it accessible. That includes making sure that we are working towards multiple ways of voting for each person. That way, depending on any of the issues going on in their life at that time, they can still cast an independent, private, and secure ballot. Some of the priority areas in that area we're going to work on is making sure that those with visual impairments, mobility issues that need to use a mail-in ballot and cannot read or have it dictated through their software on their computer, that we find a way to create a secure and easy way to allow people to download that, handle filling out their own ballots and mailing it back. That way we keep it secure and private. We're also going to be looking at voter signatures and making sure that none of the signature issues of not matching affect any of the disability community and cause any of our votes not to count. We're also going to be really looking at what we typically have to in every legislative session, and that's looking at any bills that might create new barriers to voting. This legislative session is going to be extremely important about voting. I think we're going to see it a lot when it comes down to mail-in ballots, but also at polling sites. And we need to ensure that accessibility is available in any location of where you vote, in your home, or at a polling site. One of the other big issues that I'll be working on for CTD is medical cannabis, and looking to expand that area to where we can actually have a bigger, robust system that allows for a good, regulated medical product and gives doctors and people in the community options and the choice to know what they are using to treat a lot of the medical conditions. We've worked on cannabis legislation for many years now, and we think this is the session where we have a great opportunity to move it forward and create a very responsible system within the state. And that's going to take having to listen to many of you and making sure that we are hitting all the points that you want and the things that you need and that your family wants out of a bill like that. So our hope is over the next few weeks and doing these deep dives, we'll be able to address a lot of the issues that you find or the barriers that you want to make sure don't get put in place as we move forward. So I'm going to wrap it up, and I'm going to pass it off to our Director of Advocacy, Jolene Sanders, and let her take it from there.
Thank you, Chase. My name is Jolene Sanders-Foster. I'm the Advocacy Director. I'm also a self-advocate and parent of a teen with a disability. I'm going to audio describe myself. I am a white female with black-rimmed glasses, dangly earrings. I have brown hair pulled back, and in the background is random objects I picked up antiquing and some of my kids' art. So at CTD, what I primarily focus on is children's issues, early childhood education, and also school to prison pipeline. So one of our priorities is always ECI, or early childhood intervention. It's a home-based program, for those of you who aren't familiar with it. It's a school readiness program for children 0 to 3 who have a developmental delay, disability, or other medical condition. And so the array of services can include occupational therapy, physical therapy, speech therapy, nutritional services, specialized skills training, case management, a whole bunch of stuff. It's an effective program. It's been shown that about 46% of kids who access ECI go on to not need special education when they enter school. And early childhood programs are also just really a smart investment, returning typically up to $17.07 for every dollar that is invested. So that's why it's really important for us to invest in these programs. As a little bit of a background, in 2011, our lawmakers slashed funding to early childhood intervention. They also narrowed eligibility, meaning that created an access to care problem. And then in 2015, our lawmakers cut Medicaid reimbursement rates for these pediatric therapies, which really hit ECI programs hard. To give you an idea, in 2011, we had 58 providers across the state contracted with HHSC, and now we're down to 42. So there's lots of providers dropping out of the program because they can't afford to stay afloat. So last session, we were really happy. Lawmakers approved some additional funding for ECI, but we still need to prioritize funding so that these providers can serve all kids, because they typically estimate how many kids they're going to serve, and then they serve above and beyond that. We'll also be prioritizing increasing the per child allotment for ECI, and we'll also be looking at inclusive childcare, which is something we worked on last session, not only to improve inclusivity in these early childhood spaces, but also to improve the referral rates to early childhood intervention. Currently, they only make up about 2% of referrals for ECI. Another area that we'll be working on is special education, and that is a whole bunch of stuff, and I'm not going to be able to get into all of it today, but we will have a deep dive next week into this. For those of you who aren't familiar with Texas history around special education, back in 2004, the state implemented this kind of arbitrary 8.5%, what came to be known as a cap, where schools were monitored, and they were kind of dinged if they had an enrollment of special education students over that 8.5%. So what that did is it legally delayed and denied services to eligible kids. And so in 2017, CTD was instrumental, led the way to eliminating that cap, but we still have a whole lot of work to do. So last session, we saw some improvements in special education through HB3, increasing the funding weights for special education students to promote inclusion. We saw full-day pre-K, and also the establishment of an advisory committee to study special education funding and make recommendations. There were also some school discipline bills, good and bad, that passed last session, and so we'll be coming back and relying on all of you as advocates who are interested to to also share your story, share your voice around school discipline, school mental health. We're really fortunate that we have a policy fellow, Jennifer Toon, who's on here, and she's going to be, we'll be partnering to address some of these issues that lead our kids with disabilities into the school to prison pipeline. And I'm really excited that we'll be also focusing on examining and improving services for children and youth who have co-occurring mental illness and intellectual and developmental disabilities. So with all of that, I will kick it back to Chase.
Thanks, Jolene. We wanted to put up a quick poll, and I'll audio describe it for y'all too at the same time. But the poll is about policy priorities that we have in progress and which ones y'all are interested in. So the question is, are the following among your own policy priorities? Choose all that apply. And I'm going to leave that up for a while so that y'all can take time and click on the ones, all of them if you want, or whichever ones are more of your interest. The reason we're doing this is we're taking all the feedback we're gaining today from the polls, from the next portion where we have people talking, to really come back over the next 5 weeks and every week produce a deep dive into one of these issue areas. So as we see the people who are interested in voting, we'll really reach out to make sure you're participating in the one around voting so that we can spend an hour really talking about what the issues are and who do you know that's had struggled to be able to access any kind of election. So really the input we get today from these and later on through these sessions are going to guide us. So I'm going to leave that up for a while now, and I'll go ahead and give y'all the results later on, and I'm going to pass this on to Laura and go from there.
So I think we have everyone back in the main room. Y'all, thank you for your patience as we tried out that did not go as expected experience. I hope that some of y'all still had some good conversations. And now we'll ask you to, if you have access to the chat box, type in and share a highlight or a takeaway from these conversations. And again, know that if you're unable to access chat, we will have a space for you to give us this feedback in our follow-up survey. So go ahead and chat us those responses, and we'll read through them as they come through for a second. Julie Espinoza says, cool people, like-minded. We only have the best folks. So we'll give everyone a second for that. While we're doing that, Dennis, why don't you, since we're coming up on 3 o'clock, do you want to thank our sponsors?
Well, thank you, Laura. I'd be glad to do that. And first of all, again, I want to thank everyone who's joined us today. And this really was experimental. We're going to be doing more of these, and we're also going to be looking at lessons we learned today. But what we're trying to do is, of course, engage more people and hear more information from you. I want to say I had a delightful conversation with Julie from San Antonio. In the breakout, had a little issue trying to get other folks to unmute, but I heard some interesting perspectives that, and that's what we're all about, hearing different perspectives. So today's event, as well as we have 5 more already scheduled on Wednesday afternoons. There'll be different topic issues, but always open to your own ideas on how policy needs to be changed. But everything we're doing is going to be, of course, at no charge to any of the people participating. And that is because we have some generous sponsors that are basically covering the cost for everyone to participate. And those are, I'll start off with the silver level, MCNA Dental, Shield Healthcare, and CareSource. The next level up, the gold level, Amgen, AstraZeneca, and the DentaQuest partnership. Thank you, guys. On the diamond levels, very significant financial support coming out of this tier, Superior Health Plan, Pharma, CDS in Texas, and Amerigroup. And our underwriters, our major underwriters, are Hart, InterCivic, and United Healthcare. We appreciate each and every one of you guys, and this is our first time out. Again, our first time out doing this model. I think we've worked out a lot of kinks, and I think we found a few more kinks to work out. So it's kind of like time to go to the massage therapist and work out some of those kinks. But to all of you who have joined us, please come back. please come back and you'll be getting some follow-up information. You know, we would hope to do a lot of these in person. And when we talk about what did COVID change, and one thing COVID changed is the ability to meet in groups and look each other eye to eye and hear your stories and personal stories. We can't do that, but you know what? Our goals cannot change. Just how we're going to have to work together to make them happen.